On Sunday, 9:45 in the morning, we're going to be doing a session called Clinical Pearls, but the real focus of it is going to be on genetics. And genetics, I think, is the future of a lot of medicine, and certainly in pain medicine. So we're going to be doing an overview, teaching the docs about, if they didn't graduate in the last 5 to 10 years, getting them back up to speed on genetics, understanding the basics. And then we're going to explain how genetics might predict how sensitive somebody is going to be to pain. It might predict what medicines that they will respond well to, what medicines they're going to have side effects with. It's even beginning to have tests that allow us to see if somebody's at high risk for addiction. So there's lots of potential uses that are coming out, and it's just going to get more and more as the data comes flooding in. And doctors really need to be up to speed on how this is going to affect their practices, because it will. Certainly what's already here, and I think a lot of doctors are beginning to be aware of it, and some are using it routinely in their practices, is testing of the genes that code for liver enzymes which metabolize the drugs. So by looking at genes, we can tell if somebody is going to be deficient in certain enzymes, or maybe has sort of super metabolism in other areas. So are they going to be chewing up drugs that we're giving them? Or are the drugs going to be sitting there more than we expect, producing side effects? So that's already very much available, both in predicting what kind of opioids to use, and even to some extent anti-inflammatory medications and some of the neuropathic medications. We're really now seeing the first tests that allow us to look at, is somebody sensitive to pain? When I say I have a level 5 out of 10 pain, is that what somebody else would say with the exact same pain? Well, we know that everybody is different. Part of that difference is their genetics, and we can now get a glimpse into that. Similarly, we're all struggling to deal with the opioid issue. That's a big part of the conference. One of the risk factors for a patient is their genetics. If their genetics are primed for addiction, that would be good for the patient and the doctor both to know.